So as Sandy said, I'm Dr. Kaytlin. I am with the Wellness Way in Woodbury. So we're in Woodbury, Minnesota, but we're right on the border of Minnesota and Wisconsin. So actually I'm living in Hudson, Wisconsin. But super excited to talk to you guys about something that is really important to everyone, young, old, male, female, and that's sleep. So sleep is so vitally important for resting and healing and getting your energy back. But also there's so many health benefits to getting a good night of sleep. And I don't know about you guys, but I'm definitely guilty of burning the candle at both ends sometimes, thinking I'll catch up on sleep on the weekend. But that can actually be extremely detrimental to your health when you're staying up really late, when you're working really late, when you're watching that next Netflix, episode because you're just too into it. That can actually truly affect your health. And I want to talk to you guys about that and also give you some practical tips as far as habits, sleep hygiene, but also some tips and tricks when it comes to supplements, oils, herbs that can support healthy sleep as well. So, this is a book right here on the right side, and it's called Why We Sleep: Unlocking the Power of Sleep and Dreams. And this is by Dr. Matthew Walker.
We're not seeing
Amazing.
your PowerPoint. I'm just seeing you.
Huh, let me try this again.
Okay. It's saying I can see it. So good.
Can you see it now?
The attendees are saying yes, so go ahead.
Okay. So this book has a lot of really great information. I just pulled a few things out of this book, but this is a doctor who studies sleep and the effects of sleep on your health, which is really something that isn't studied as much as it should be. We're just told, get your 8 hours of sleep, otherwise you're going to be groggy the next day and you're going to be depending on caffeine to get through your workday. But there's actually a lot more than that. So what studies show is that two-thirds of adults fail to get 8 hours of sleep at night. So if you're getting less than 8 hours of sleep a night, that's you. Sleeping less than 6 to 7 hours a night routinely more than doubles your risk of cancer. So think about it. Are you only getting 7.5 hours? Are you only getting 6.5 hours a night? That could be detrimental to your immune system. Alzheimer's is highly associated with, a sleep deprivation. Even 1 week of inadequate sleep can affect your blood sugars to the point that your levels can appear pre-diabetic. So when I look at my patient's hemoglobin A1C and I'm seeing that it's above 5.3, close to a 5.7, I'm putting them on a no sugar diet. But what if you could start improving those blood sugars by getting 8, 9, 10 hours of sleep a night? Inadequate sleep can increase your risk of cardiovascular diseases, depression and anxiety, and also weight gain. So it's really interesting when you have a lack of sleep, that's going to increase your appetite because it's going to increase a hormone called ghrelin. And that hormone gives you that appetite. It tells you, I need to eat something. And it's going to decrease your hormone leptin. And what leptin does is it tells your brain, we've had enough. We are full. We need to be done eating. So you feel like you need to eat and eat and eat and eat. So if you ever notice, like you have that initial feeling like, I'm kind of tired at 9 o'clock, but I'm going to push through it because I'm really into this show, or I'm trying to finish this project for work. You get past that initial tired slump, and now all of a sudden you're hungry and you're snacky. That's because it's affecting those hormones. All right, let's see if I can keep. There we go. Here we go. If you don't sleep, you don't heal. That's why I care about sleep for my patients. I care about it for my family because that is when your body's going to release melatonin, and that's your body's second best antioxidant. So if you're not getting that good sleep where you got that melatonin, you're not healing the way you need to every day. So this is from the Cleveland Clinic, talking about insomnia. It's when you experience disruptions in your sleep, and about 10% of the world's population is severe enough to be diagnosed with a medical condition of insomnia, but there's a lot of people who aren't necessarily medically diagnosed, but aren't getting that adequate sleep. Now, Cleveland Clinic does say it's not usually dangerous, and there are many medications and mental health options to treat it. So let's talk a little bit more about that. So insomnia, what is it? It's when you aren't sleeping as you should. So it might mean you're not sleeping enough, like you're only getting 6 hours. You might not be sleeping well when you're actually sleeping. So like sleep apnea, where you feel like you're sleeping, but you wake up and you're just exhausted the next day. Or you might have trouble falling asleep or staying asleep. So if you're one of those people, you wake up at 2, 3 a.m. every night, that's not normal. So for some, insomnia is a minor inconvenience, and for others, it can be a major disruption. And that's why there are a lot of reasons why insomnia happens. So I'm going to talk a lot about different reasons it can happen, but it's going to be different for every single person. So your body needs sleep for many reasons, and science is still unlocking and trying to understand why sleep is important. And this is something in that book. He talks a lot about science, and medical doctors really don't have a great explanation for why sleep is important and why we sleep. I mean, if you look at it from, an evolutionary view or even a creation view, what's the purpose of sleep? Now you're more vulnerable. You aren't able to socialize while you're sleeping. You're not able to hunt and forage while you're sleeping. You're vulnerable to attack. So why would our bodies need to sleep every single night? And there's actually a lot of really great reasons for it. Now, how common is insomnia? So, as I said earlier, 10% of adults meet that criteria for that insomnia disorder, but roughly 1 in 3 are going to have insomnia symptoms. So, that's a really big amount of people that are struggling to sleep at night or struggling to stay asleep. So, some complications that can happen with sleep deprivation is going to be daytime sleepiness. And that's dangerous because if you think about it, if you're driving home and you're tired, driving tired is a lot more lethal than driving drunk, and driving drunk is not okay. But driving when you're really, really tired can be very detrimental as well because you don't even really notice. You're just driving, then all of a sudden you kind of like jerk up and think, I don't even remember the last mile I drove, which is a very scary place to be. But it can also lead to increased risk of depression and anxiety, high blood pressure, heart attack, and stroke, obstructive sleep apnea. So that's where all of a sudden you can't breathe while you're sleeping and it either wakes you up or you just get really terrible quality of sleep. Type 2 diabetes, as we mentioned earlier, going a week without quality sleep can affect that blood sugar regulation. Obesity, because it's affecting those hormones that cause your appetite to go up. And then conditions that involve psychosis. So if you aren't sleeping, you can literally go crazy. We've seen it happen. And we'll talk more about that with neurotransmitters as well and how it can affect your brain hormones. So how does medicine treat it? What happens if you go into your medical doctor and you say you're not sleeping? Well, they're gonna talk about developing and practicing good sleep habits like sleep hygiene. So they're probably gonna tell you go to sleep at the same time each night, try to get your 8 hours, try to wake up at the same time every morning. And then they have medications and mental health care. So, medical treatment, there's a wide range of medications that can be used to help you sleep. They all come with side effects and risks, but again, you need to sleep or you don't heal. So, we've got benzodiazepines, Z drugs, so often grouped with benzodiazepines. That's going to include Ambien. So, I'm sure a lot of you have heard of Ambien. That's the one with the butterfly. A lot of people end up sleepwalking with Ambien. A lot of people end up with a lot of different mental health issues after taking Ambien. There are dual orexin receptor antagonists, so it's going to block your body from reabsorbing that hormone that's going to make you sleepy. Then we have anti-seizure medications like gabapentin, which is going to help with restless leg syndrome, which keeps a lot of people up. And then there are antidepressants. A lot of people are on antidepressants and SSRIs so that they can sleep. But that completely alters your mood and you become very dependent on that medication. And then there's melatonin and other related drugs. So there are prescriptions for melatonin out there, but your body naturally makes melatonin and you can actually test to see how well is your body making that melatonin as well. So I like to use this analogy of the fireman and the carpenter approach. If you've heard me speak, you've already heard about this, but let's apply it to sleep. So with medicine, looks at someone who just cannot sleep. Well, let's figure out whatever we can do to get them sleeping. So the allopathic approach is let's treat the symptoms by using some drug therapy like benzodiazepines, Z drugs like Ambien, anti-seizure medications like gabapentin and Lyrica. And these might help you sleep, but they do come with some major side effects. You may feel extremely drowsy the next day. You may become dependent on an antidepressant at this point. Can make you feel like completely flatlined and not like yourself. But at the end of the day, why are you struggling to sleep is my question. So maybe we go alternative medicine approach, treating the symptoms by using healthy things, by using foods, by using herbs. Melatonin, you can supplement with that. It's something that's on our shelves at our office. Calcium and magnesium, very important nutrients if you want to be able to sleep at night. Valerian is an amazing support, especially when it comes to those brain hormones that keep you up at night. A lot of essential oils. We'll talk about oils, but also supplements through doTERRA. That can be amazing support. And then passion flower is another really great one as well. Now, I love all of these. I tell my patients to take these things. However, my question is, why aren't you sleeping? You aren't deficient in a medication. You aren't deficient in an herb. And we need to find out what is interfering with that good quality sleep. So some of the things that I think about is how are your hormones? And hormones are going to be those female and male hormones, especially estrogens, why a lot of women when they hit menopause are not sleeping. And it makes you crazy. Well, cortisol is another big one. So your fight or flight hormone and checking in on your adrenal glands, but also insulin is a big one. Food allergy testing because inflammation, high inflammation, can put you into fight or flight as well. And that can get in the way of sleeping and good quality sleep. Mold testing. I can't tell you how many patients of mine that have struggled with sleep and haven't been able to find relief. We find out that there's mold behind their bed or there's mold in their closet and it's triggering an immune response that's keeping them up at night. Stool testing we'll talk more about, and then neurotransmitters. So those are brain hormones. And that's what I have here on the left. We don't talk a lot about that, but you can test your neurotransmitters to see do you have a lot of inhibitory hormones or do you have a lot of excitatory hormones keeping you up at night? Are you eating a lot of foods with MSG in them? That's monosodium glutamate. Glutamate is one of those neurotransmitters that's very excitatory. So it's going to get you wired, it's going to get you excited. It's also going to keep you from sleeping. So, what are some factors that can disrupt your sleep? Well, really anything that can cause inflammation can disrupt your sleep, and it's going to be different for everyone. But it all falls into three main categories. The first one is going to be physical trauma. That could be, I'm going to have a lot of examples on the next slide, but it can be things like sitting at a desk all day, getting into a fender bender. That's where that chiropractic adjustment really, really shines. So, seeing your local chiropractor. Toxins like gut infections, mold, what are you eating on a day-to-day basis, and then mental stress, which is a huge one for so many people. If you have racing thoughts at night, how are you going to fall asleep? So this is a little bit of a mix of physical, but also a little bit of chemical as well. But concussions are a huge physical stressor. If you have a history of concussions and you haven't had proper rehab after, you could struggle with sleep and insomnia. Traumatic brain injuries, severe illness or infections, military combat. So if you have PTSD, you try to fall asleep and all you can picture is that traumatic event that you went through, that can keep you from sleeping. Surgery, having a baby is a big physical stressor, but also baby doesn't always let you sleep. But then also that can lead to postpartum depression when you aren't actually getting that sleep after having babies. So making sure you have a good support system around you so you can get at least a nap here and there. Cortisol and sleep. So cortisol is your fight or flight hormone. So think you're getting chased by a bear. Your body is going to produce a ton of cortisol. And what that cortisol is going to do is make you run faster than you've ever ran before. It's going to make you stronger than you've ever been before. But also, it's going to shut down your digestive system. It's going to shut down your ability to relax and shut down your ability to sleep. Because if you're getting chased by a bear, the last thing you want to do is take a nap. Now, the way your body handles stress is going to change your ability to get good quality sleep. And these are 5 ways that stress is going to affect your ability to sleep. So it's going to activate your stress response, the HPA axis. So that's hypothalamic, pituitary, and adrenal axis. So hypothalamic and pituitary, those are organs within your brain. And then your adrenals are some glands that are on top of your kidneys. And those adrenal glands are what raise your cortisol level. And that's going to keep your body really alert when it should be winding down. That's why maybe it's not the best time to have a really deep discussion with your partner in an argument right as you're going to bed at night because it increases that cortisol and you might struggle to sleep. And if you have elevated cortisol, it's going to block your ability to release that melatonin, which is going to help you with falling asleep and getting good quality sleep. It increases your alertness at bedtime, so it's going to trigger hyper arousal. So your body is going to stay stuck in that fight or flight, thinking you're getting chased by a bear. You're replaying your day. You're worrying about that thing you messed up with at work. You're worrying about your day tomorrow. Your nervous system can't switch gears into rest and digest mode. It will also shorten your sleep duration. So chronic stress, it can lead to difficulty with falling asleep, so sleep onset insomnia, or you might wake up frequently at night, meaning that you aren't able to get into that deep sleep state. It's also going to reduce your sleep quality. So it suppresses your ability to get into deep sleep and REM sleep, which is when your body is repairing and healing. Your brain is processing your emotions and your memory. So then when you're not getting that good sleep quality, you might be getting 10 hours, but you're feeling groggy and you're feeling emotionally drained the next day. And then number five, it's going to lead to a vicious cycle because if you're not getting good sleep, either quantity or quality, now you don't have the reserves and you don't have the energy to deal with stress the next day. Now you're going to struggle with sleep again the next night, and it's going to get worse and worse and worse. So, what is the role of cortisol in our sleep? Well, we have something called a circadian rhythm. So on the right here, you see daily free cortisol. This is literally a chart of what your cortisol rhythm should look like or your circadian rhythm should look like. This is a dried urine hormone test. It's on our Dutch test. And essentially you pee on the strip right away when you wake up in the morning, 2 hours after you wake up, in the afternoon, and then right before bed at night. And it's going to measure that wave. And what you want to see is as you wake up in the morning, your cortisol should start to rise. 2 hours after you wake up, it should reach its peak because you're getting your coffee, you're getting your kids off to school, you're getting to work, and you need to get stuff done. And then it should gradually come down in the afternoon and should come to its lowest point at night because you need to be able to shut off and go to sleep. Now, chronic stress, whether it's emotional or due to dietary habits like consuming too much sugar, it can cause your cortisol to stay really, really high, and that's going to get in the way of sleeping, and it's going to cause hormonal imbalances. So what you can see with this patient of mine on the right here is she had a very, very stressful job. Now she quit that job because she was trying to reduce her stress, but it was kind of too late. She already had been in that chronic stress state for years, and now her adrenal glands are pumping the brakes saying, we can't do this anymore. So you can see she is the black dot. She is below the range across the board. Her adrenal glands can't even make that cortisol to get her through her day because she's burnt herself out, which is also going to affect that sleep as well. You can get too tired and too fatigued to the point where you really can't get things done during the day, but you're also wired at night too. And then low melatonin. So melatonin, I'm sure most of you have heard of this. It's a hormone produced by the pineal gland and it's located within the brain and it's going to regulate your internal clock. So it's going to fluctuate throughout the day, but it's really triggered by darkness. So let's say you're going to bed and you have the curtains open, it's still light outside at 9 o'clock here in the summer. Maybe you are watching a show with your partner to fall asleep and get tired. Well, that blue light and that light from outside, it's triggering your pineal gland to wait on the melatonin. As soon as you shut the blackout curtains, turn off the blue lights, that's when your body starts to release that melatonin, and that melatonin tells your body, okay, it's time to go to sleep now. So you can actually get your melatonin tested to see if that could be one thing that's getting in the way of that proper sleep. Now, how many of you on here have taken melatonin and it did nothing for you? Well, your melatonin might actually be totally fine, But for others, it might be really, really low, and that could be a reason why. So there is going to be sleep hygiene that's going to be very important so your body can produce its own melatonin. But also melatonin supplementation for a short time can be very beneficial with getting your body back on that circadian rhythm. So this was actually on a Dutch test too. This was actually my Dutch test a few years ago. My melatonin was tanked out and I was struggling. And the big reason my melatonin was so low is because I was staying up till midnight. And then I would wake up at 6 a.m. Not nearly as much sleep as I needed to function. And my body wasn't able to produce that melatonin the way it needed to. You can also get your neurotransmitters tested as well. And this is also a urine test. So what you'll see at the top, the first six hormones here, the tryptophan, serotonin, the GABA, the taurine, these are all called inhibitory neurotransmitters. So what that means is it's going to calm everything down. It's going to shut things down so you can fall asleep at night. So if you've ever heard of tryptophan, that's what we think of when, you had your Thanksgiving turkey and now all of a sudden you're tired and you're ready for a nap. That's because it does contain some of that neurotransmitter. It's going to help calm you down. Now, the bottom half of this is going to be excitatory neurotransmitters. If these are high, you're going to be wired. You're going to have a hard time falling asleep at night. Now, this patient, everything was low except for GABA. So at least they did have one inhibitory neurotransmitter, but the fact that the rest of them were all low and their excitatory were low, this was actually someone who was suffering from insomnia, was suffering from not being able to sleep well, and also had schizophrenia. So a lot of mental health issues going on, and there was a lot of work to do to get these neurotransmitters balanced out again. Now, aside from hormones, there's also immune system stressors that can get in the way of that health. So if any of you are on TikTok, you've probably seen some videos that talk about how parasites are just, the end all be all of all of your symptoms. If you have a rash, if you're struggling to sleep at night, if you have PMS, if you have PCOS, you have parasites. Now, you guys, I 100% disagree with that everyone has a parasite, but a lot of people do have parasites, and you can actually test for them and find out if you have a parasite. Now, this is a study about the complex interplay of parasites, their hosts, and the circadian clock. So, very interesting read. So, if you guys take a picture of this, you can always look up the study later. But it talks about how parasites will actually cause their host to get on the same circadian rhythm as them. So if you have a parasite, you might struggle to fall asleep, stay asleep. You may get really, really moody. You may get really itchy during that time. So when I mean during that time, full moon. When it's a full moon, that's when we see people really struggling with sleep if they have a parasite, because those parasites become very hyperactive during a full moon. I know it sounds kind of hokey, but it's true, and science has actually shown this. So the graph on the right-hand side shows how there's a rhythm between how your host and your parasite interact, and the parasites eventually are going to get you on their circadian rhythm. Now, I never assume someone has a parasite. You can test for parasites. Is it 100% accurate 100% of the time? No. Parasites don't want to come out of your body. They're going to hang on to the sides of your intestines and they're going to lay their eggs and they don't want to come out. However, we can try our best to test for them to see if microscopically or in a PCR test we find them. We can also test your immune system to see if your immune system is making cells designed to attack parasites. And that's going to give us the best chance of really figuring out if you do have a parasite or not. So for this patient, she is struggling with sleep. And we did find that she had two different parasites within her gut. She has blastocystis, which is by and away the most common one that we see. She also has Entamoeba coli, and that was from a microscopic analysis. So scientists could literally see the parasites within her stool. Then on the right-hand side here, we have a PCR test for parasites to make sure we don't miss any. We also detected it there as well. So parasites, not fun, not easy to get rid of, but you need to know if you have them. But in addition to parasites, you could have very similar symptoms because of a bacteria infection or a yeast infection triggering that immune response. So for this patient who was struggling with sleep, he had a red pathogenic bacteria infection within his gut. He also had 3 non-pathogenic infections that were also triggering his immune system, causing massive inflammation within his gut And there's a huge gut-brain connection. If you're super inflamed in your gut, you're going to be inflamed in your brain as well. And that's going to cause some struggles with falling asleep. Now, in addition to gut inflammation, mold exposure is a huge one. And I've had quite a few patients where we get started on food allergies, we get started on sleep hygiene, we get started on gut, and we start working on some things, and their testing is starting to look better. They're making a lot of improvements, but sleep isn't budging. And then we find out that there's mold behind their bed or behind their curtains, and it's affecting their health and it's keeping them up at night. So this is a study about how mold can actually affect your sleep. So dampness and mold at home and at work, and onset of insomnia symptoms, snoring, and excessive daytime sleepiness. And what the study found was dampness and mold at home and work can increase the development of insomnia, snoring, and excessive daytime sleepiness among adults. But a lot of people think, well, I have a brand new townhome. It was built in 2024 or it was built in 2025. There's no way I could have mold. I've had patients with $1 million homes get offended because I just brought this up and come to find out they did have mold in their home. It doesn't matter if you have a brand new home, sparkling clean, or a 100-year-old farmhouse. You need to, assume that there's a chance there could be mold. And if things aren't getting better, you should test for mold. It doesn't mean that you're not keeping a clean home. It could be that when they were building your home, maybe there was a rainstorm, and they didn't properly take care of the water damage before they finished off the house. So this is the results of a patient who actually came in very recently. So this was collected on June 23rd of this year. Actually is a little boy and he is struggling to sleep. He is 7 years old and his parents have to sleep with him every night and they have to lay with him for about 1 to 2 hours every night or he can't fall asleep. Come to find out, he has crazy high levels of ochratoxin A, which is the most common mold that we see in water damaged buildings. And he also has another type of mold toxin as well that is less common, but also affecting his sleep as well. So guys, you cannot underestimate mold. And by the time you actually see mold in your home, it's been there for a long time. So what are some conditions that are associated with insomnia? Acid reflux or gastroesophageal reflux, so GERD. So think about it. If you're eating food, then you go to bed and you feel a burning sensation. That's going to keep you up at night. It's going to make you struggle to fall asleep, and you probably don't want to lay down. You probably want to go sit in an armchair. Obstructive sleep apnea, restless leg syndrome, just because you just cannot get that rest. Your body has to move. Fibromyalgia, which is really just a chronic inflammation condition. ADHD, so it can lead to insomnia due to neurotransmitters like glutamate, like that MSG. Menopause, that's a huge one. If your adrenal glands are stressed out and then you go into menopause, all of a sudden you're not sleeping. Heart disease, particularly congestive heart failure, so that can be associated with that. And then mental health conditions like anxiety disorders, depression, bipolar, and then neurological conditions like Alzheimer's and Parkinson's. So they tend to have higher levels of inflammation within their brain, and that brain inflammation can keep you from getting that restful sleep. Now, there's actually some really interesting studies out there on Alzheimer's, and there's a really awesome scientist. His name is Dr. Christopher Exley. He did a study on brains of people with Alzheimer's who had died, and he checked their brains and he found just immense levels of aluminum within their brains, all across the board. There was every single person with Alzheimer's that he checked their brains, they had crazy toxic amounts of aluminum within that brain. He did the same thing with people who had died who had autism and found way more aluminum in those brains of people with autism than those with Alzheimer's. So, not going to mention it on the recording, but there are lots of ways we can get aluminum within that brain tissue, medical interventions that can lead to that high inflammation as well. But then what's causing inflammation within your body that could be getting in the way of that proper sleep? So I covered up the information, but this is actually my food allergy test. I wanted to show you guys my most recent one. So this is from March of this year, and this is IgG food allergy. So this is chronic inflammation causing food. So it's not an instant reaction. It's not like you eat cow's milk and all of a sudden you're got a rash or you're anaphylactic. It's more chronic inflammation that you might not have a symptom for 30 days after you eat that food. Now, for me, there are a lot of healthy foods like apples, blueberries, dates, goat milk, honeydew melon, even black and white pepper. Those things for me cause a lot of inflammation within my body. And I've been allergic to black and white pepper for the last 4 years. I get it retested every single year. If I have black and white pepper, I it takes me like 2 hours to fall asleep. I have heart palpitations, I have anxiety, and I don't know what's wrong with me. And then I eventually realized, oh, I had black and white pepper. Oh, I went out to eat and there was pepper on that. So don't underestimate the effect of chronic inflammation on your ability to sleep as well. Now, blood sugar dysregulation is a huge one. So if you find that you are waking up between the hours of 2 a.m. and 3 a.m. every single night, that is more than likely a blood sugar issue. So get your glucose tested fasting. You want to see it between is 75 and an 85, but also get your hemoglobin A1C tested and your insulin. Hemoglobin A1C is a 3-month average of that fasting blood sugar, and you want to see it less than 5.3. Anything above 5.3, we know there's brain shrinkage, degeneration, memory issues, brain fog. Medicine wants to see you less than 5.7 because then they can diagnose you with prediabetes, but you don't even want to get close to that. Insulin, you want between a 2 and a 6. Anything above 6, you know that there's the start of that insulin resistance process starting for you, which can also lead to weight gain as well as impair your ability to sleep. So if you do have that problem where you're waking up between 2 a.m. and 3 a.m., first of all, stop eating by about 7 p.m. at night. Make sure you're eating high, good quality fat meals like salmon, eating avocados, olive oil. Those are some good fats to get into your diet, but also take some magnesium. And there's also some other herbs like chamomile that can support you if you're experiencing those blood sugar crashes in the middle of the night that are waking you up. Now, when it comes to sleep, there are so many more stressors that could be getting in the way of that sleep. But really, the way that we look at it is we don't want to just look at sleep. We want to look at your body as a whole. And we look at it like a Swiss watch. So, a Swiss watch has a bunch of little gears in it that all have to work together in order for your watch to function. And if you were to take out one little gear or damage one of the gears, it will affect all the rest of the gears. And it might be easy to blame the other gears, but that's just because they're all affecting each other. Now, our body is the same way, but instead of gears, we have organ systems. So, the biggest one in the middle is your nervous system. So if you have physical stress on your nerves, if you have physical stress on your spinal cord, that will affect how your brain can talk to your body and vice versa. So that's where finding your local chiropractor is going to be amazing because they can help take some of that physical stress off of your nervous system so your brain and body can communicate again. And, if any of you do struggle to find a chiropractor in your area, reach out. I can, take a look and see if I can find anyone I know or can help you vet some people too. But it's so important to make sure you have a good quality chiropractor who's focused on the nervous system. Now, aside from that, your hormone system could affect your immune system. Your digestive system can affect your respiratory system. So if we're only looking at where you have symptoms, we could be missing where the stressor actually lies. All right, so I want to give you guys some practical tips to get the best sleep of your life. So what can you do to reclaim sleep? Well, when it comes to our approach at the Wellness Way, when it comes to sleep, we're thinking get adjusted, whether that's with us or with a local chiropractor or a chiropractor you love. Check in on those hormones. Make sure you're eating good quality foods that are not inflammatory to you. Cutting out gluten and dairy can do wonders for a lot of people. Detoxing, exercising, and reducing stress. Stress is a huge one. So I want to send you guys home with 8 simple tips to get better sleep because these simple habits and these simple changes can make all the difference for a lot of people. So a few changes are going to be set an early bedtime. So for a lot of people, especially women, you want to shoot for getting to bed by 9 or 10. That regular bedtime can have a positive impact on your health. So why between 9 and 10? because that's when your pineal gland is going to be producing and releasing that melatonin at the highest concentration from 9 to midnight. That means if you are one of those people who says, well, I don't really get tired till 1 a.m., but I don't have to work until the afternoon, so I just go to bed at 1 and then I wake up at 10 o'clock in the morning. Yeah, sure, you're getting the hours in, but you're not getting the melatonin. So it's not going to be the same quality of sleep. And that's why if you're going to bed after 1 a.m., if you're going to bed after 12 a.m., you might feel a little bit more groggy. Get inverted, so an inversion table or doing yoga poses that gets your head down low. That's going to take a lot of pressure off of your adrenal glands and your heart and set you up for better sleep. Eat your veggies, so make sure you get potassium, magnesium. Now, if you lay down at night and you feel a heartbeat in your ear, like you can feel that pulse, you're not getting enough potassium. You want to make sure you're getting at least 4,700 milligrams of potassium a day, which 1 in 10 people is getting that much. So a good source of potassium would actually be the leafy green part of beets. So you can make green smoothies out of beet greens. You can make salads out of beet greens. They have 1,300 milligrams per 1 cup of beet greens. Bananas only have 400. So I would switch over to those beet greens. Also, Swiss chard is a really great source as well. And then try CBD oil. That can be amazing for reducing stress. But again, get your food allergies tested first because I'm one of those people. I'm allergic to hemp. CBD stresses me out. So again, take a lot of these with a grain of salt. It's going to be different person to person. Sleep in total darkness. So getting blackout curtains is important. Don't have a TV in your room, you guys, and have your phone way on the other side of your room or in your bathroom if possible, because that blue light is going to signal to your pineal gland that it's daylight, and then you're not going to release melatonin properly. Skip the alarm. If it's going to startle you awake, you're going to wake up super stressed out, and it's going to spike your cortisol. So try a light clock, music to slowly wake yourself up. And then this is super important. Get outside and ground. Take your socks off, take your shoes off. Go put your feet in the grass, even for 10 minutes a day, especially now in the summer. That research has shown will help reduce inflammation, but also it's going to help reduce or regulate those cortisol levels. And then get tested. Your body is meant to rest at night. So if you're not resting at night, there's a lot of tools we can use to help our bodies rest, but also we need to find out what's getting in the way of getting that proper sleep. So this is a study about grounding. I love grounding. It's so important for reducing stress, reducing insomnia, reducing inflammation. So this talks about all of the benefits, and they actually did a randomized double-blind placebo-controlled study, which is gold standard study. So what they found is taken together, earthing is beneficial for improving reduced stress, insomnia severity, and daytime sleepiness. And it results contribute to increasing sleep time and provide preliminary evidence for the beneficial effect of increasing sleep quality via reducing the stress response. So get outside, you guys, every single day, or get a grounding mat if you can't make it outside. Now, I want to talk about how men and women are different when it comes to sleep. Women need more sleep than men. We want to shout it from the rooftops. We hold out signs on the side of the highway because it's that important. Men really only need about 7 to 8 hours of sleep. Women, we do a lot better with 9 to 10 hours. So here's a study if you want to take a picture. This is about the sex differences between males and females and the human biology, the changes between us as far as who needs more sleep and who needs less sleep. And what the study found is women need about 8 to 10 hours of sleep minimum a night. Men can get away with 6, 7, 8, and they're just fine. So I want to show a video that explains it. And this is Dr. Patrick Flynn. He's the founder of the Wellness Way. So he's out in Green Bay, Wisconsin. And I think he explains it perfectly. So hopefully you guys can hear this.
Hey Doc,
Yes.
why do women need more sleep than men?
Oh, they need dramatically more sleep than men. I can always say this: man can get away with 7 to 8 hours, but that means a woman needs 8 to 10 hours. And the key is what's called hormonal reserves. See, if you think of it this way, women depend so much on their adrenals to produce even daily hormones. A man does not. Men can produce maybe 2-3% of their adrenals, and 97%, 98% is produced by the testicles. Testicles work if you're sleeping or not. You know what I'm saying? That's kind of funny saying that. women need a certain adrenal reserve of hormone being produced to create their whole anabolics. Women need a lot more sleep than men. Women need uninterrupted sleep. Men can get away because a lot of their vitality, a lot of their repair is done by testosterone. It's mainly made by the testicle. Yes, there's a small amount, and maybe a small amount can do it that way. But I would tell you right now, men need a lot less sleep than women, and women need good sleep between 8 and 10 hours to create the hormone reserves for them to have a great day.
Okay, thank you.
You're welcome.
So essentially, looks like I'm
Hey,
getting,
Doc.
Yeah.
sorry guys.
Why do women?
So essentially, us women, we are just very complicated. So we need a lot of sleep to heal and repair
Yeah.
and to get
Why do
those
women
hormones
need more
working
sleep
again. All right. So women, make sure you're getting to bed between 9 and 10 p.m. Men, between 10 and 11 p.m. Get that good quality sleep. But also get adjusted. So why is getting adjusted so important? Because we're living in fight or flight. We're living in the part of our immune system or part of our nervous system that's known as the sympathetics. So it gets us through our day, but also it's stress. And we need to be able to get into our parasympathetics, our rest, digest, heal hormones in order to get that restful sleep. Getting good quality adjustments can support your body in getting back into that parasympathetic range. So what I do at my office is I use an instrument and I focus on those parasympathetic ranges. I'm not looking at where is your back pain. I'm looking at where do you actually need to get adjusted so that your immune system can calm down so your body can heal itself again. Now, I'm going to just show you guys a couple little slides about that just give you a little sneak peek at our sleep challenge guide. So if any of you are interested in getting our sleep challenge guide, I would encourage you guys give our office a call tonight, leave us a voicemail, or give us a call tomorrow and set up a free 10-minute discovery call with me and just let me know you want it and I'll get that sent to you. But this is in there. It talks about some really great tips on what you should be doing during the day to set yourself up for good sleep at night. So harnessing natural light, getting out in the sunlight, staying active regularly, sticking to a routine sleep schedule, minding your diet. So cut back on the caffeine. Don't drink alcohol. So alcohol, you may feel sleepy, you may go to sleep right after you have a glass of wine, but it's really terrible quality sleep. Manage your stress, hydrate wisely, napping smartly. So if you need a nap, keep it short. So really the best window is about 20 minutes of good quality sleep. Is if you go above that, you may be more groggy. And then winding down in the evening. So switching to reading books instead of watching Netflix. And when I mean read books, don't read books on your cell phone. I mean, I was guilty of that. I had Kindle Unlimited and I love reading books on there, but that blue light is going to delay your melatonin from being released and you won't get that good quality sleep. And then time to wind down, setting a regular bedtime, unplugging and unwinding. So turning off all of your screens and dimming your overhead lights too, 1 to 2 hours before bedtime. And then engaging in relaxing activities like deep breathing, a calming book, gentle stretching, a soothing bath. We'll even talk a little bit about some stuff you can do to make that bath even more relaxing. Complete your nightly ritual. So consistent habits that tell your brain, okay, it's time to wind down. We're about to go to sleep. And then setting the mood. Ensure your bedroom is cold, it's dark, it's quiet, and you have comfortable bedding and relaxing sounds if needed. So a really great app that I use sometimes if I do struggle to sleep is the Calm app. They have sleep stories, they have different white noises you can use. They also have a lot of really great like meditations and different things you can do to help calm down. Now, this is in that sleep guide. So for those of you who are like me and love checklists and checking off those boxes, you're going to love this guide. But step number one, evaluating. So filling out a sleep inventory and a sleep habit assessment that's included in this guide. Step number two, making a plan on preparing your bedroom, setting daily goals, keeping a sleep diary, and then building healthy habits and reflecting and celebrating, and then keeping it going. You know, these habits should become a lifestyle for you. So this is what that sleep inventory looks like. You would fill this out and evaluate where you need to start changing some habits. And same with the sleep habits assessment. This can be really telling. A lot of you might think, well, I do all the right things. But then when you actually look at it and evaluate, you may find that there are some things you can tweak. So again, if you want the guide, go ahead and reach out to our office. I'll have our phone number at the end of this presentation. Set up that free 10-minute discovery call with me and I'll get that sent over to you. Now, what happens if you've made all the changes, you've done all the things, but you still can't sleep? That happens. You need to get tested, whether it's gut testing, neurotransmitters, hormones, blood sugars. You don't know until you test, and you don't want to guess with sleep because it's that important, you guys. If you're not getting adequate sleep, your quality of life is going down, but also your lifespan is going down. Studies show that people who don't get that quality sleep don't live as long. So it's that important, you guys. It's literally life or death. So I want to talk a little bit about some herbs and some support when it comes to sleep. So a couple of things that I commonly will put my patients on. The first one is California poppy. This one is like a glass of wine without being a glass of wine. It's just going to support your ability to deal with stress. So it's very, very calming. Another really great one would be kava. My favorite herb is kava because it's very anti-anxiety and it just makes you feel really, really good. So some people love poppy, some people love kava. California poppy is really great if you have just racing thoughts at night. You can't stop thinking about your day. You can't stop thinking about the next day. You're thinking about the stupid thing you said. California poppy is going to help calm all that down. And it's going to help you stay asleep. Kava can help you fall asleep, not necessarily stay asleep. Now, valerian is very supportive with GABA, very supportive with sleep disorders and anxiousness as well, but also headaches and heart palpitations. So if you have a hyperthyroid, you feel like your heart is going to beat out of its chest when you go to sleep at night. Valerian can be a great support for that as well. And then we've got our foundational wellness and Terrazyme. So foundational wellness, if you aren't getting the nutrients you need, you're not going to be able to have the health you need, the healthy gut and the healthy brain in order to fall asleep. Now, doing the PB Restore is just going to support those good, healthy probiotics within your gut, helping to feed them, and also supporting healthy blood sugars. Now, E omega, getting good, healthy fats in your diet can support healthy blood sugars, so you're not waking up in the middle of the night every night. And then Terrazyme, digestive enzyme complex to support not only your digestion, but also metabolism as well. Then we have adaptive, which is very supportive when it comes to stress. So boosting mood, helping you feel more tranquil, helping to soothe and uplift, but also it's very calming and relaxing. And there's like a lot of different ways that you can support your body with adaptive. So there's the roll on. So let's say you're going on a work trip, but you want to bring your adaptive with you, roll it on that work trip, on your wrists, and just let that tension flow from your body. You can take some capsules along with you as well. And then also the oils you can diffuse. So you can start to build these habits too. Have a diffuser right by your bed. Start diffusing adaptive, 30 minutes before you want to go to sleep at night to retrain your brain to calm down at the end of the day. Calmer, restful blend. This roll on your spine, on the bottoms of your feet, on the back of your neck to help calm things down. But also you can put it in a spray bottle and spray it on your bedding, spray it on your pillow. And that can help signal to you, okay, it's time to relax and it's time to unwind. And then there is the Serenity Sleep System itself that can be an amazing tool to support your body in sleeping. So take 1 or 2 doTERRA Serenity Restful Complex soft gels when it's time for bed. You can do the Serenity Stick, and that does have valerian in it too to help with those neurotransmitters. And then diffusing the Serenity Restful Blend is also a really great support too. Copaiba oil and soft gels are great too. 1 soft gel is needed or 3 to 5 drops in a veggie capsule. And it's just going to give you a sense of well-being. So if you're one of those people where it's hard to fall asleep because you just feel anxious, and you just feel like something's wrong and you don't know what it is, or you can fall asleep, but then 25 minutes later, you're up in a panic and you don't know why, Copaiba is a really great support for that too. It is going to support and soothe your nervous system. And then you can combine geranium and 5 drops of lavender. So 5 drops of each with a 1/4 cup of therapeutic bath salts. If it has magnesium, that's even better. Dissolve it in your warm bath water and then bathe in it in the evening to help signal to your brain and your nervous system, hey, it's time to calm down and let's get ready for sleep. And then there are some essential oils that are just really great support in general. So Balance is one of my favorites that I use quite often, especially when I am trying to fall asleep. Lavender, and then of course Adaptive, as we mentioned earlier. So I hope this was helpful. I hope you guys come away with some really good practical tips and tricks. But also, you guys, there's a lot you can do to support your sleep through supplementation, through essential oils, and that's amazing. But there may be some different inflammatory triggers that are keeping you from that sleep as well. And that's where getting good quality testing and really navigating through that and finding out what you need to change, it's going to be highly individualized. And that's what we do at the Wellness Way. So we are in Woodbury, Minnesota. However, we see patients from all over the US via the phone as well. And we've been doing that for years since we opened. We've been doing virtual appointments as well. So we have it down to a science. So for any of you guys on here today, I do want to offer you a discounted new patient appointment as a thank you for hanging out with me tonight. So our new patient appointment, it is valued at $435. That includes review of past test results. So anything from your medical doctor you can send to us. Full spine x-ray if you can come in person, a consultation, and then an exam. And then at the end of that appointment, that's when we recommend the best quality labs for you to find out what is interfering with your quality sleep. So that appointment, instead of $435, I want to give you a discount of that $99 new patient appointment. So if you can give our office a call, just mention doTERRA or say you were on the doTERRA Zoom tonight and they'll give you that $99 new patient appointment. And then I would love to connect with you guys. So this is how to get a hold of us. So we have 3 different doctors in our office. We have Dr. Alex on the left. She's the blonde. Dr. Jen is in the middle. And then I'm on the right. I'm Dr. Kaytlin. Our phone number is 651-330-9453. No one's at the office right now, but you can definitely call. Leave us a voicemail while you're thinking about it. Schedule that new patient appointment. We'll get you that discount or schedule a free 10-minute discovery call if you just want more information and find out if we'd be a good fit for you. You can also send us an email. We also do have an online booking app as well. However, you won't get that doTERRA discount until after you've already paid the full price, but we would be able to use that as a credit towards your testing. But it's just better if you give us a call. All right, and then of course, connect with us. We're on Facebook, Instagram, TikTok, The Wellness Way, Woodbury, but also I'm on there, Dr. Kaytlin Westerberg on Instagram and TikTok as well. All right, you guys, thank you so much. I'm going to stop sharing my screen and turn things back over to Sandy.
Thank you so much, Dr. Kaytlin. It was fantastic. I'm going to see if I can bring my slides up here. Hopefully, I'm getting some air. So, Kayla, can you bring those up? I'm definitely having crazy messages there. Are you able to bring those slides up, Kay?
Yes, Mom, my screen's up.
Okay. I'm not seeing it. Is everybody seeing her slides? She is. Okay, let me see if I can do this. Okay, so I think hopefully Kayla's got the slides up that say the 10% off of the Deep Blue Stick as well as Malama, and the trio is still available. And also the class for next week is hopefully going to be on there. And I'm going to see if I can bring it up here. Anyway, I'm not seeing it, Kayla. Do you want to go ahead, Kay?
Mom, I am sharing my screen.
Can you talk? I'm not, it's not on my.
Okay, so next Wednesday's class is Understanding Your Nervous System and How We Get Stuck in Emotional Patterns with Joyce Ann. And then the following week is Foundational Wellness with Alicia Hogstead. You can join the Facebook group by either scanning the QR code or entering the website link below. It is case sensitive, so it is bit.ly/discover essentials. And please join their email list. It's nice to get those weekly reminders for the classes. So that's bit.ly/email list DE. And again, it is case sensitive. And then please do not forget to fill out the form for tonight's class or scan the QR code. And then some of us, most of us should be getting towards a graduation. So go to bit.ly/grad progress 2025. And then please check out the permanent library. There are some amazing classes that have been put in there. Scan the QR code or enter bit.ly/permanent library DE. Again, these bit.ly links are all case sensitive. And then the graduation gifts, Gabriella, Alicia, and Betty are so generous. So you can pick between 2 emotional therapy oils or the doTERRA teachable courses. And those are the social media or the essential oil certification. And if not, take a little journey out to training.doterra.com and find other courses that you might want to take. There's a lot out there. Again, 10 classes gets you a free teachable course or 2 free aromatherapy touch oils.
Mrs. Nikhil, I really want to promote that essential oil certification that she has up right there, because those are worth $97 each versus the oils. And what an amazing way to get that free education.
And then 3 ways to purchase is retail, which is the most expensive way. And the saying goes in doTERRA, we don't let friends buy retail. We just don't. Wholesale is 25% off. And then below wholesale, buy a kit, and that waives $35 fee. And then here are the kits: Home Essentials, Healthy Start, some other ones. And then the resolution kits, I recommend this one because it has a little bit of everything. And then you can still customize your kit, Meta Power kit. And then to fit any questions, contact Sandy at that phone number or her email address.
Thank you, Kayla.
You're very welcome.
Dr. Kaytlin, can you pick a number from 3 to 102?
52.
All right, Kayla will look that up. And if you wouldn't mind, you can go, I do have access. Are you seeing the slides that are coming in? Are the questions, excuse me?
Yes, I can see them. So the first one is
Hi.
not necessarily a question, but Zachary said nursing
Recording stopped.
has to have night shift workers, makes it kind of hard. Yeah, definitely. And a lot of studies on night shift workers show that they're more at risk of all of these different diseases like cardiovascular disease. A lot of people who work night shifts, that quality of life goes down, but also quantity. Lifespan is shorter, which I hate to say, but it is true. Night shift is killing a lot of people. So really when you do work night shift, like try to keep it as temporary as possible. Don't do that for 40 years being the night shift nurse because it really is detrimental to your health if you can help it. Let's see. Robin, our body cleans us out while we sleep. Absolutely. If you don't sleep, you don't heal. So you need that good quality sleep. Crystal, I sleep really good from 10 to 2 a.m. and then 2 to 5 a.m. I wake every hour to look at the clock and go back to sleep. That makes me think blood sugars for you, Crystal. So just getting that hemoglobin A1C, that insulin, and your fasting glucose is really important.
Hi.
Eating good quality fibers and also good quality fat before you go to bed. So make your dinner your fattiest meal and try to stop eating by about 7. Zach, I'm so glad I have no issues with pepper. The pink pepper has helped me quit cigarettes. Well, that's awesome. So, fun fact, pink pepper is a different protein than black pepper, black and white pepper. So that's actually a good alternative for people with pepper allergies. And then Robin M says grass-fed European butter is a good fat. Yeah, absolutely. Also, ghee is a really great way if you are allergic to the protein in cow's milk to get around it by doing grass-fed ghee. And then Elaine, so I can't blame my 70-year-old bladder for waking me up at 2 a.m. I sleep from 8:30 p.m. to 2 a.m. Then I normally can fall back to sleep. I eat really clean and very healthy and wake up around 4 or 5 a.m., ready to walk my 6 miles every day. So this could potentially be blood sugars, but it sounds a bit more like kidneys. So getting your kidney filtration checked, so your GFR, and making sure that that is above 90. Because if your kidneys aren't filtering the way they should, then they can wake you up more often in the night. You should be able to sleep through the night. And then that's a crazy amount of potassium. Yeah, but most people are deficient in potassium. And then Mary Kay, earthing mat on a bed is fabulous. Absolutely agree. So the grounding mats, you can get some for under your desk if you work a desk job. You can get some for your bed to use. My mom swears by it. I got one, didn't love it. So it probably depends on the quality of the brand that you get. Does age factor into the amount of sleep you get? My grandma only slept about 3 to 4 hours a night. As people age, naturally, they do start to sleep less and less. That doesn't necessarily mean it's normal. It's just common. And it's probably because people are stressing their body out, they're inflamed, and they're just struggling to sleep more and more. But when people are not getting that good, adequate sleep, that's when we do see a higher risk of things like cancer and Alzheimer's. So my husband's grandma, she got dementia and she's only sleeping like maybe 1 to 2 hours a night. Very, very common with those different mental issues that are going on. Let's see. Shirt Wetzel. I've seen grounding bed sheets. I wonder if they really work. And then Mary Kay recommended earthing.com. I think that's great. I got one off Amazon. I don't recommend it. Didn't work for me. It's probably a cheap brand.
Dr. Kaytlin, I typed in there as well. They did not work for me. So I tried different ones and they
Mhm.
let me try them. If you can try them before you purchase it, please do so.
Yeah.
Because like me, they did not work.
Yeah. Just expensive, uncomfortable sheets otherwise. So what if we supplement with melatonin? What time should we take it? In the evening. I don't typically take it right as I'm going to bed because I want to give it some time to like the capsule to open up for it to actually, get absorbed by my body. But usually I say like 1 to 2 hours, 30 minutes before bed should be just fine. And then a few people are asking about putting their phones on do not disturb mode and putting it on their bedside drawer. So there is going to be EMFs, which is a whole nother topic we could talk about sometime. But it's the blue light that's really what's going to get in the way of that quality sleep. So if it's next to your bedside table, you're so tempted to look at it, double check that you set your alarm, look at your text, look at Facebook. It's just a temptation. But if it's outside of your bed, you'd have to get up and go grab it to go check things. And that's the way it should be. You shouldn't have that quick access to those blue lights when you're in bed because that's when you need total darkness. And then a few people asked about our number. So thank you for putting that in the comments. It is 651-330-9453, or look us up on Google and you'll find us there too. Let's see. The sleep system is incredible for sleep, CRP and reversing bio-age. I love it. And Calmer is Anisha's favorite. And then combining Copaiba and Serenity system 1-to-1 is a 10. Awesome. Love it. Let's see. I use a sleep app and it shows me regularly in bed for 8 to 9 hours, but mapped sleep 6 to 7 hours, light sleep, deep sleep, core sleep, REM, and deep sleep. Thoughts? It depends on how you're measuring that sleep. So if it's just an app on your phone and you put it on your bedside table, I don't really put a lot of stock in those. If you have a wearable device like a watch or like an Aura ring, that could be a little bit more accurate as far as like, are you getting into that deep sleep or are you staying in that really light sleep? All right. And then Mary Kay puts Copaiba under her tongue right before bed. I love it. And then Mary Kay, do any of the doctors in your office treat babies and children? I love seeing babies and children. I do have 3 boys of my own. They're getting older, 9, 11, and 13 now. But I do have advanced training in pediatrics as well, and I am a member of the International Chiropractic Pediatric Association. So love seeing babies and kids and pregnant women in our office. All right, I think that might be all the questions.
Absolutely. Thank you. Thank you. Thank you for sharing your expertise. And somebody put in there, this is more about diagnosing. It is about why do we not sleep?
Mm-hmm.
Are we in pain? Are we, like myself for years and years from a car accident? Am I hurting? I'm not sleeping. Is it like she said, finding out what exactly is there mold? So we want to just not put band-aids on things. So good comment. But we are looking to support you with all different ways. But the root cause, like Dr. Kaytlin said, why are we not sleeping? And often for people, it's a busy mind, or they can be digesting instead of resting, just all kinds of things. So hopefully you found this class very helpful. We want to thank everyone that was on. And Dr. Kaytlin, thank you, thank you, thank you for being on. So please unmute everyone.